Good morning, everyone. I'm Peter Stanton, the publisher of the Worcester Business Journal, and your moderator for today's session on Back to Business, Operating Your Company in the New Normal. This program is part of our ongoing COVID-19 webcast series on managing through a time of crisis, and it is made possible through the support of our presenting sponsors, Webster 5 and Fallon Health, two organizations who together are supporting this series of educational sessions aimed to help Central Mass business owners and executives successfully navigate their way through the current economic and health crisis. In this webcast, we'll speak with an attorney, a doctor and healthcare professional, as well as two retail executives about how companies are handling the reopening process. From best practices to mistakes to avoid, the better you understand the law and state guidelines, the more successfully you'll be able to manage your team and keep the workplace a safe environment during the pandemic. We're pleased to have with us this morning a terrific panel for today's conversation, and they include Joseph Bartulis, who is the chair of the Labor and Employment Law Practice Group at Fletcher Tilton PC, Dr. David Bromley, the Vice President of Medical Affairs for Fallon Health, Renee Diaz. Hi, Renee.
Hi.
A little away from the people. Who is the owner of the Queen's Cups, which is a highly successful bakery in Worcester's Canal District, and she also writes a column for WBJ. And Michael Cavino, who is the president of the Niche Hospitality Group, which owns and operates 10 restaurants, as well as True North Performance Training. So thank you all for joining us this morning. And we're going to start with a presentation with Joe Bartulis, who's again, an attorney with Fletcher Tilton, and Joe's going to walk us through some of the legal framework of how to approach the back to business and reopening. Joe, it's all yours.
Thank you. Good morning, everyone. Hopefully everybody can hear me all right. So what I've put together here, I've put together a number of slides. In the limited time that I have allotted to me, I'm really only going to give you several of the high points on these slides. That's by design. But the Business Journal will be making available to you a copy of the PowerPoint afterwards, and people are always happy to reach out or able to reach out to me with any further questions. We will then get into some more greater specifics during the question and answer period, and I'm happy to kind of dialogue with folks at that point. But so without further ado, we'll jump right into it. First slide, please. Okay, next slide. So we're going to look quickly at some of the big Roman numeral kind of areas where employers are vulnerable as a result of the pandemic. So next slide, please. So one of the first areas that an employer needs to be mindful of is areas as it relates to wage and hour law violations. So real quickly, what are they? We've got two laws that are implicated. The first one is the federal law, which is your Fair Labor Standards Act. And then you've got your Massachusetts Wage Act, which I've put on the slide there as Mass General Law 149, Section 148. I've put a couple of the key takeaways there for you, but one of the keys to keep in mind, and this applies specifically with regard to any work that an hourly paid employee is doing, many of whom are working remotely, right, or have been, is under Massachusetts law, every hourly paid employee must be paid for all time he or she works. So the issue then is, well, what do we count as time worked? Well, if somebody's regular hours are 8 to 4, 10 to 6, whatever they may be, that might be the way it is in the workplace, but you might have put in place some protocols by which employees are contacting you or you're contacting them outside of normal business hours. What's the takeaway for you? The takeaway is all time worked must be paid for. They check emails, they respond to texts, they respond to after-hours phone calls. All that time should really be documented and confirmed. Next slide, please. I just got a couple touch points there. To make sure that you know what you owe these folks, you need to have them punch in and out at the start and end of their workday, as well as punching out for any paid or any unpaid anyway, meal breaks or other breaks that you may provide. Now, another key is that employees must receive a meal break if they're working 6 hours or more per day. Again, what is the takeaway for our purposes here? The takeaway is that all wage and hour laws apply, regardless of whether the employees are working on site, at some other remote location, or working from home. Okay. Now, hourly employees must be paid overtime for all hours worked in excess of 40. That's one of the points that I wanted to put in there. Again, we're going over these things quickly, but I just wanted to, again, point out to these things for you. Let's look, what happens if somebody isn't properly paid? Now, the timing of the payment is your pay period for hourly paid employees can be weekly or bi-weekly, and then you must pay them within 6 days of the close of the pay period to which the earnings are tied. What's the downside if you make any missteps on any of these things? An employee can bring a wage and hour claim, and he or she can allege that they were not properly paid what they were owed when they were owed it. So that means they weren't paid for time checking emails or any other gaffes that the employer may have purportedly made. What would be the remedy? The remedy would be 3 times what the employee would have earned in straight time, or would have earned, whether it was straight or overtime, the amount owed, 3 times that, plus having all of their reasonable attorney's fees paid. So the cautionary tale is, make sure you comply with all wage and hour laws while people are working remotely, or once they've come back to work, as they may be doing right now. Next slide, please. Okay, again, I've pointed out a couple of the laws that you might need to be worried about. Another one is the Massachusetts Earned Sick Leave Law. Won't get into the particulars of it, only to remind you that every employee must at a minimum receive 1 hour of paid or unpaid, depending on the size of the business, for every 30 hours worked, up to a maximum of 40 hours. I next point out to you that under the Federal Families First Act, there are means by which an employee can get up to 2 weeks of paid employee sick leave, and they can also get up to 10 weeks of what we call Enhanced Family and Medical Leave Act leave. The particulars are right there. We can get into more details if people have questions about them, but the gist of that is under the coronavirus pandemic, the federal law made some exemptions here that create carve-outs for employees to access. What's interesting about this law, and it's the first point I made under the Families First Act, is that this is only eligible for employers with 500 or fewer employees. There are some exemptions for very small employers. I won't get into particulars now, but people are reminded that normally the FMLA, one has to have more than 50 employees for that to normally be triggered. That doesn't apply here. Next slide, please. Okay, under the FMLA, again, you can have up to 12 weeks. The first 2 are presumed to be unpaid if you're staying home to care for a child under 18. If you are staying home for that purpose, the employee would get 2/3 of his or her pay, up to $200. Now, again, what is the key for this? If you're not complying with this law, these people could bring a federal lawsuit by saying you denied them their FMLA leave right. That's the takeaway for you here. So I won't get into particulars of the law, only to point out that you're responsible if you don't follow those things. Next slide, please. So real quickly, what are some of the potential wage minefields during the pandemic? The first one, as I point out, is if the employee hasn't kept accurate records. Remember, they're supposed to, hourly paid employees anywhere, are supposed to punch in and punch out whenever they are working or not working. You must pay employees for all time worked, you must pay them overtime, and you must approve properly requested leave tied to COVID-19. As I pointed out, if you make any mistakes on any of those, you've got potential violations. Next slide, please. I won't get into particulars of this, only to say that if you discriminate against an employee during the COVID-19 by virtue of your characterization or your perception of their disability, you run the risk of them bringing a claim under the Americans with Disability Act. And I just point out a couple things in there to do that. We can get into a deeper dive during the questions if people have some. Next slide, please. Okay. If you take a job action, that is, let's say you terminate somebody, you lay them off, you choose to relocate them or change their work hours, maybe because you think you're doing it out of what's in their best intentions, the employee can bring a claim claiming that you discriminated against them based upon their health conditions, and you would have to then justify that the layoff, the termination, the change in job duties was not at all related, right, to their underlying condition if they didn't ask for the ADA accommodation. That's the key I wanted to point out. Next slide, please. Okay. Were someone to bring an MCAD claim, that's the common place people would bring these claims in Massachusetts. One has 300 days to file a claim, and basically the job action would be, let's call it the layoff. They're in a protected class. There's a causal link they would allege between their job action, i.e. the termination that they've suffered, and the job action, and then the timing of it creates the inference, of course, that it was improper. Next slide, please. There were Osha claims, and I just want to point out that a person could bring an Osha claim. We can get into that if people have some questions on that, but the takeaway is that the employer is obligated to provide a safe workplace. If it fails to do so, a person could bring out an Osha complaint, and that there could be costly repercussions for failing to provide a safe workplace. Now, an employee gets injured at work, what would be the statute that would normally be implicated? It would be workers' compensation. People often say, can they sue their employer for a workplace injury they've suffered? And the answer generally would be no, that the forum for that would be a workers' compensation case if they got injured at work. Next slide, please. One of the things I just want to point out is some of you may have heard of, maybe you haven't, something known as the WARN Act. The takeaway is this: if you are a covered employer, that is one with 100 or more employees, and you are having or suffering a mass layoff or a plant closure, and you are laying off enough people, that would be 50%, 50 of your 100 or more employees, or 1/3 of your employees if you are laying off more than 50, it triggers the payment of 60 days advance notice, or the giving of 60 days advance notice of the pending termination or mass layoff. And if you don't comply with that, you owe them 60 days pay for not having complied. So again, that's something you want to keep in mind. Many states, including Massachusetts, had what is known as a mini WARN Act. That's been found to be unenforceable in Massachusetts. So I just want to make a passing reference that that doesn't apply. Moving right along, next slide, please. There is an exemption to the WARN Act that I just want to point out called the Unforeseen Business Circumstances, which basically relieves a large employer from having to give that 60-day advance notice. And I would argue that the pandemic, that last point that I make on that slide, I think it's very arguable that the pandemic would fall squarely within that definition, which may absolve you from having to do that. But here's the key takeaway from this and our quick discussion on this. With regard to the WARN Act, the unforeseen business circumstances have to be proximate to when you're making the purported layoff and avoiding the 60-day notice, right? You can't rely back 4 months later and say, we're letting you go now for unforeseen business circumstances about which we became aware 3 or 4 months ago. Next slide, please. And then again, if you are going to be asserting that, you would want to make a WARN Act exemption. You'd want to point to show that you've got unforeseen business circumstances, maybe your business records, financial records, canceled orders. Key takeaway is that you're not absolved from giving any notice if you have a WARN Act exemption that's applicable. You just not need give the full 60-day notice. So that was kind of the key overview, if you will, of some of the key laws that would be implicated by virtue of the pandemic we're suffering. We're happy to talk through, as we will in a little while, questions and answers that people have. Thank you, folks.
Joe, that was terrific overview, and I know that a lot of the questions that were submitted before have to do with a lot of the legal issues. So I think we'll circle back on a number of those details. Next, we're going to hear some comments from Dr. David Bromley, who is the Vice President of Medical Affairs for Fallon Health, and he kind of has the double-barreled perspective of both being with a major employer that has a lot of best practices and going back to work, and a medical view of the pandemic and a lot of safety issues. So, Dr. Bromley.
Thank you, Peter, and thanks to the Worcester Business Journal for the opportunity to speak with you today. What I'd like to do initially is talk a bit about what we've done at Fallon in response to the pandemic, quickly touch on some mandatory safety standards that have been put out by the Massachusetts government, state government, and the DPH, and then touch a bit about where we are currently with Fallon's progress, and then be happy to answer some of the questions as they come up. So initially, as most companies, most people, we responded fairly quickly when the orders to move people out of the buildings and offices quickly. We had developed quickly a rapid response team that consisted of a pandemic recovery team of our senior management and other key individuals, particularly in IT. But we very quickly had to determine how best that we were going to work with the majority of our employees out of the building and working from home. We had a great response from our IT team in developing the infrastructure and the necessary tools and IT resources to enable people to work from home rather quickly and very effectively. And they've been very great at getting things beefed up and keep things running smoothly. So we've had some great progress there. Communication is very important, and that's been a focus throughout this. We've had regular communications from our CEO, Richard Burke. We've had regular communications from our HR partners on tips on working from home remotely, how to navigate all the different IT technologies and all the different platforms to help facilitate employees being effective at home as much as possible. We have had also, as many of you know, Summit Elder Care, which we have 5 sites where we have employees that are taking care of frail and vulnerable patients. So we've had some to look at our technology and our processes and procedures and policies to take that into account as well. In terms of what the Massachusetts current safety standards, they really fall into 4 major categories that I'm sure a lot of you are familiar with: social distancing, hygiene protocols, staffing and operations, and cleaning and disinfecting. So touch on those a bit. So social distancing, again, everybody's familiar probably with the 6 feet apart guidelines, and to the greatest extent possible. There are some new regulations that have come out. For example, the requirements are to not have more than 10 people per 1,000 square feet. Establishing protocols for social distancing. So we put in place things like one directional hallways and arrows. Looked at our elevators. Again, it's difficult to socially distance in an elevator, but we've limited that to 3 people at a time to help facilitate the social distancing in that area. There has to be signage, of course, for safe social distancing and reminders to employees in the buildings. Face coverings and masks are required. And then for hygiene protocols, there's hand washing capabilities throughout the workplace, which have to be in place. We've increased the number of hand sanitizers that would be available to employees. Encourage frequent washing, hand washing, making the equipment available, and training tools, which have been put out for employees in order to make sure everyone is familiar with the hand washing protocols, and certainly encouraging frequent hand washing, the more often the better. In terms of staffing and operations, training for employees regarding social distancing and hygiene products needs to be available. We've done that online. We have tools in our internal educational system, as well as posters that have gone up throughout the building. Another key factor is employees who are displaying COVID-19-like symptoms should not report to work. So there are various options about that. I'll touch on that in a bit later. But in terms of screening and attestations, we have several tools in place for that as well. There's also, it's a recommendation to keep a log of workers and customers to facilitate any kind of contract tracing that would be necessary. Employers will have a key role in that, which I will talk a little bit about as well in terms of the current recommendations with the boards of health. Cleaning and disinfecting, we need to establish and maintain regular cleaning daily or more frequently as possible. Also keep a cleaning log to make sure that all the surfaces have been adequately taken care of in that regard. There are also some requirements for MassGov in terms of posting notices to workers and customers that all these measures are in place. There are checklist forms available on the mass.gov website, which are very helpful in making sure that you are complying with all these mandatory recommendations. And then an attestation form that needs to be filled out for the plan and the things that are in progress with your particular employer in terms of the building and people coming back. So where we are currently is, again, communications has been key. We have continued to send out information. Another important piece is thinking about employees' mental health, and even additional things have been put in place around online yoga training, different tips around wellness, and encouraging people to take advantage of their vacation time, and rest and relaxation is obviously very key. Continue to communicate regularly about the current plans as they develop. We, like most employers, I would think, are being very careful. Safety is a key factor, so we are not rushing to get as many people back in the building as soon as possible, really focused on making sure that people have the tools to do their job where they can. And for those that are returning and do need to come in at least part-time during the weeks, certainly all these safety measures are in place, and we'll continue to move forward with that. It's also very important to continue to monitor the changes in policy, particularly with the state, with the DPH and the CDC, as well as OSHA. So we are continually monitoring those and updating as necessary. Training is an important piece. We have web-based tools, communications in place that help encourage and instruct people how to maintain social distancing, proper face mask wearing, hand hygiene, and so forth. One of the key things is not allowing people, or at least checking with people before they come into the building in terms of any types of symptoms. This really helps minimize the risk of infection. There are several approaches to that. One that we are in development is an attestation that every day before employee would come back into the building, they would answer some fairly straightforward basic questions about typical COVID-19 symptoms, fever, cough, for example, and then also the recent activity to make sure that they were following social distancing guidelines. And then based on their responses, they would get a clearance to come into the building or a recommendation to not come into the building on a particular day, with the additional recommendation of reach out to your physician if you are experiencing or showing some symptoms for further guidance. There's also some employers that have taken up the approach of doing temperature screenings when people come into their buildings. We are doing this in our Summit elder care sites, primarily because we are dealing with a very high-risk population from a clinical perspective and very close face-to-face. So we want to take every precaution that we can with those members and patients in those facilities. We are, as far as our main building on Chestnut Street for temperature screening, we have decided that really asking people around their symptoms and then also providing them with a thermometer so that they can do that as sort of their welcome back to the building, it will be the approach there. Just want to touch a little bit too quickly on testing in terms of COVID-19 testing, acute testing, and antibody testing. Those the recommendations are currently not that those are really need to be in place for people returning to work, other than if they've been positive before, but there's no current recommendation around doing antibody screening to see if people have immunity. Part of that is because the testing have a significant number of false positives and false negatives. And then lastly, I just want to touch briefly on the local boards of health, which are a key piece to the contact tracing, as well as offering support for questions and the guidance. They are the primary source for contact tracing. So that responsibility should be with the local board of health. If an employee becomes positive or has been exposed to someone who's positive, the best approach is to contact the local board of health in the town in which they live, who would then do the contact tracing. I think employers can certainly play a key role in supporting that if there's some difficulty getting contact information or reaching out to the employers. That's certainly a support. And recently there are some recommendations which I would encourage you to take a look at around reporting of non-conforming businesses. So the local boards of health also and the DPH also have the responsibility for monitoring the mandatory guidelines. And there's a mechanism where they encourage non-conforming businesses to be reported to them for their follow-up. So with that, I think I'll stop and look forward to the questions.
Terrific. Thank you, Dr. Bromley. And our next presenter or conversation is with Renee Diaz. Renee is running, as I mentioned earlier, the Queen's Cups, which is a retail business. And so, Renee, maybe you can tell us about what opening has looked like and what the employee experience and customer experience has been able to be.
Yeah, so everything's changed. It's completely different. Before all of this, I had 25 employees and now I have 12. Before we were open 10 to 12 hours a day, and I'm changing everything. We're opening earlier, closing earlier. We're going to be closing on Sundays and Mondays. We're changing our menu up a little bit. So even though this was definitely difficult at times, in a way it was a blessing in disguise, because I've been in business for 8 years. I've never had the time to sit down and really see what was working and what wasn't working, and really evaluate like some of our practices and everything that we've done. So I've really been able to take the time. We've been doing online ordering this whole time. We're hoping to open up to the public on the 21st, so next week, a week from now. I've had to completely change my bakery, the way that you enter, the way that you exit. There was definitely not enough space before around our pastry case, so I've had to make before what was the pastry and checkout area, that's going to be a little lounge area. And then what was the dining room is going to be the checkout area, because it's much bigger and there's a door that you can exit through there. So it's definitely been a learning experience. I've had the same employees working the entire time. We've had a lot of discussions about what's going on, and some days have been great. Some days have been really difficult. It's been a confusing time, especially having some employees that are a lot younger. But yeah, it's been a ride, I would say.
Okay, sounds good. And so we'll have a bunch of questions, I think, that have to do with kind of operating in that retail space when we get to the Q&A section. Michael, you are in what's recognized to be one of the toughest industries in terms of how it's been hit by the pandemic. Maybe the Hanover Theater, right, and a few other entertainment venues, but certainly restaurants have a big challenge. And so what has this meant to you? And I know you also wrote recently about some state legislation trying to ease things for your industry. So how's it been going?
Well, it's like Renee said, it's been a unique time. Prior to COVID, we had 10 physical locations, and then we do have one gym. We have a performance training center. And then as of March 15th, we got the word that that wasn't going to be the way anymore. And so we were unfortunately faced with, we had over 400 employees at the time, and we were faced with, that in our business, there isn't an option for sort of a virtual job, right? We're customer facing. So unfortunately, we were faced with a large amount of layoffs. And so we went into the takeout only business for a period of time. And we realized that at some of our locations that wasn't going to work. So we ultimately had diminished down from 10 locations to 4 locations, which we did into early April, and it was very stressful. We were doing phone orders and delivery orders with third-party delivery services, and it was very nerve-wracking for our employees and for us to try to operate that way. People were very nervous about getting the virus and contracting it, and we were trying to maintain social distancing. And early April was much different than it is today in terms of compliance, and even a grocery store was much different in early April than it is now in terms of one-way aisles and barriers and things of that nature. So we ended up having to close everything completely for a couple of weeks to kind of hit reset, because our staff was very nervous and concerned. And then we relaunched again May 1st, and we relaunched with mobile ordering only. We weren't doing delivery because we couldn't control the amount of an influx of delivery drivers coming into our physical plant. And so we did that. We've been since May 1st only functioning with 4 of our fixed burger bar location in Worcester and in Marlboro, Mezcal in Worcester, and Bocado. As of recent, we were able to first they added outside dining, and that started off, great. And then of course it gets more humid, and like every July in Worcester, it's people want to don't want to sit in humidity. And then we've added the inside dining as well. So now we have sort of takeout which I would still say is probably more robust than it was prior to COVID. And then inside dining, there are some people that are comfortable with it and some people that are not. There are some people that are comfortable with outside dining only and not inside. And at this point, we're really functioning at about 30, maybe as much as 50% of what we would normally do prior to COVID. So it's very challenging because we're trying to rebuild a workforce. Some people are very excited to get back to work. Some people are very nervous to get back to work. So we're still adjusting. We're going to add 2 more locations to the mix in September. We're in a wait and see mode to see how the numbers kind of still continue to roll out as we move into the fall and winter season. So it's a huge learning curve. There's a big piece of reset, like Renee talked about. There's a big piece of redesign that Renee talked about. We don't see regular bar dining coming back anytime soon. We're trying to figure out how to create our physical plants in a way that we can get back to the experience that we want to offer at Niche, the food and the beverage and the feeling that you're being taken care of. I feel like our marketing is really all about what we're doing because of COVID. Like all the things that Dr. Bromley talked about, we're doing as well. And I feel like that's like became our marketing campaign, right? We have a dining playbook we have a dining playbook for our guests. We have a huge playbook for our internal staff as far as how we're gonna, operate hand sanitizing stations, all that. And I feel like it's really taken over, and it's not that it's anti-hospitality. It just doesn't feel like we're doing what we love to do, which is create a memorable experience for the guests. So I'm looking forward to adopting a lot of these changes for good, but I want to do it in a way that I can get back to screaming from the rooftops to come in and eat and drink and get respite and enjoy it for what people normally came to dine. So,
yeah, wow. Well, that's a great update. It's interesting how you one of the issues that you mentioned is sort of our first set of questions, which I'd like to jump into now. And since we're not all in the room and I can't point at someone, I'll sort of ask you. I'll start with you, Michael, and then I think others can jump in and also address this. We had a number of questions that has to do with fear of returning to work from employees, right? And so one of the questions was, how do we address employees who continue to be afraid, even though all safety precautions are in place? What do you do around those issues of fear?
First thing we did was, I have an HR person, so she was not laid off, right, for obvious reasons. And she's amazing. Nancy DeFina is amazing. So she works with National Restaurant Association, Mass Restaurant Association, the state. She follows everything that's being reported on every day. So we had to create internal standard operating procedure playbook, right? So we need to share that with our staff. Some staff are comfortable and some are not. Because we're rebuilding, it has not been like, it's not like, okay, we're going back to normal, so we need you all to come back today, right? So in a situation where you lay a lot of people off, you're really rebuilding in a way where you're reaching out to people and saying, are you comfortable to come back, right? And if it's a yes, then it was great. What questions can we answer? And if it was a no, it really hasn't been a pressure situation for us because we didn't really need everybody in a rebuilding phase. We haven't really had to face, us personally, haven't had to face a, well, we need you and you need to come back situation. So there's nobody that's working against their free will at our restaurants at this point in time. People that came back wanted to come back, and there's a million variables there, right? In terms of people that are collecting unemployment, and then there's stimulus dollars, and can I come back? Will I earn? So there's a whole bunch of unraveling to be done there. But as far as the safety piece goes, anybody that wanted to come back, they read our procedural guide, they felt comfortable with those things, and then therefore came back on their own will. So we didn't have a lot of convincing to do. We didn't have to talk people off the ledge. We just answered their questions and told them what we were going to provide for PPE and such. So.
Got it. So a cousin question, and Joe, maybe this, and anyone else can jump in on that same question, but a cousin to that is, some folks who don't want to come back might be in a high-risk group. Others are just not comfortable coming back. and there's the question related to, well, if they just don't want to come back and they're not in a high-risk group, are they using paid sick leave? And at a certain point, when are they actually not doing the job?
Okay, so you've given a couple kind of points, so we'll take those in sequence. So first of all, with the people who are in the higher risk group, right? I would argue that those are controlled by what's known as the Americans with Disability Act, one of the points that I briefly touched on in my remarks. And under the ADA, a person who has health concerns, right, demonstrable health concerns, you would engage, the employer would engage what's known as an interactive process with the person where they would enumerate what their concerns are, what their health issues may be, and then there's an interactive process, right, to say, look, you know, we'll take these steps to accommodate you. Maybe that involves teleworking from home. Maybe there are other things, but that's kind of the interactive process to see whether or not ADA accommodations can be made for a person who has health issues. For the person who does not enumerate any health issues, but rather just makes this conclusory overarching statement that I don't feel safe going back to work. And there could be many motivating factors as to what that may be. Maybe they truly just don't feel comfortable about coming back. Maybe some of them may wish to stay on unemployment. We don't know what the drivers may be, but if in that case, an employee may only refuse to come back to work if he or she believes that their safety or their health would be in imminent danger by returning to work, that the workplace is effectively unsafe. And in that case, the OSHA regulations are quite clear that the safety issues are not that I might get COVID, but rather that I might die, or there is something that is very, very serious to my health if I was to return to work. And then even in that instance, the expectation would be that the person would conceivably engage OSHA, who in turn would do an investigation to determine whether your fears are well-founded or not, and then they could give you further guidance. So I won't get into too much detail on that. If at the end of the day, there is no, the fear does not rise to the level of imminent danger, and they have not presented you with medical necessities for an ADA accommodation, then to your point, Peter, what can you do? Well, if the person has, if the employer wishes to provide them unpaid leave time, they can certainly do so. If the employee may have any paid leave time on the books, or the employer simply wishes to pay them to remain out, that's certainly their prerogative. One of the questions I get faced with then is, well, why would I do that for that person? And we're going to have a groundswell possibly of other people making similar requests. So you got to keep that in mind too. At the end of the day, though, keep in mind, many employers that I'm dealing with will say, look, if I allow this person to remain out on unpaid leave, is that basically a continuation of the furlough that they've been on, right? And now am I responsible for my experience rating at unemployment by virtue of the fact that they would like to remain out on furlough or continue to be unemployed? Or can I shut the spigot off with regard to unemployment because I've called them back to work, they're just simply refusing to come back to work? And I'm getting into the weeds a bit on that, but I think there's an argument to be made that once I've offered the opportunity for the person to come back, they can go out on paid or unpaid leave, but arguably the spigot for unemployment would presumably cease at that point.
Got it. You know, I think a lot of us employers are just sort of not even thinking about the future unemployment insurance taxes. That's not a very nice thought to have. Let me pivot to another question that I think a couple of you can speak up to. Michael, you mentioned that you've got a policy booklet that you're in the magic business, right? But you're so attached now. You got a policy booklet related to employees and related to customers. And one of the questions was, as a small business owner, and you've got an HR person, Renee, maybe you don't, right? Do you need to have a formal written policy of safety procedures for your internal staff? And when you've got customers interfacing with you, do you need a similar set of sort of publicly placed policies for them, in addition to that kind of 6-foot signs?
Well, I don't have an HR person. It's just me and one other girl that I work very closely with. So I'm more of like a hands-on learner. So I have, we have like things that we need to do, obviously the masks and the signs and everything, but I kind of need to open to see what it's going to be like. I mean, when we open our business again, it's going to be completely different than it was before. So her and I just are trying to do as much research as we can, and, you know, hopefully it abides by all the laws in place and everything, and go from there.
Mm-hmm.
And I would just add, you know, there's on the mass.gov website, there's a lot of helpful tools. So they have not only the safety standards, but they also have a very helpful checklist. They have a list of best practices. They have posters that you can print out and post in your work site and so forth. So that's a great resource, and it's continually updated. You know, they're based on the CDC guidelines and the best clinical knowledge that we have that continues to evolve. So that's a great resource that I would highly recommend if you haven't looked at it.
We created the playbook. I mean, we know we had to have all those posters, and there were certain things that the state said these were what you had to do. So we did that. We created the playbook from a best practice from another restaurant group. We have a screening. We have it's basically a daily screening log. So we're doing temperature checks on all of our employees when they come in. We're asking them 4 basic questions that are COVID symptom related. So we have an exact policy and procedure in place. That's so that we can handle all of the employees when they come in, which I think makes our employees feel more comfortable with, okay, we have a plan in place for people to come in and get checked. So nobody's balking at doing that. So, and then we did a little sort of an external dining playbook, so to speak, for the guest in returning to dine, making a reservation, contactless payment. We specifically state that we're asking our internal employees, our staff, to make a health declaration, and we sort of ask them to honor that same declaration. Like, please don't dine in our restaurants or come inside our restaurants if you have a fever or you have symptoms of COVID and things of that nature. So we don't have it in place to actually take a temperature check or do a screening on our customers, but we do state that we are doing that for our staff. So we did those things. I don't 100% know if we had to. We felt like it set the tone for both our internal employee and our internal customer and our guests. So,
Got it. So, related question probably for you and Dr. Bromley, since Renee is not open yet. Have you had to say to customers, you need to put your mask on? Have you? There's been a number of stories in the national press about some, you know, kind of mind-blowing confrontations with like a teenager who's, you know, servicing a customer. Have you run into that yet?
I have. We have in the restaurants, you know, so our staff is wearing their mask the whole time. And then we ask our guests that when they arrive to the restaurant, there's a check-in procedure that they have their mask when they check in, they have their mask on when they're being brought to their table, even if it's outside, and that they can take their mask off when they're dining. And then we just ask them if they could kindly keep their mask on when they're going to the restroom, so to speak, right? And so I think most of the cases have been someone doesn't have their mask on. You say, oh, I'm sorry, do you mind? Could you please? Not, oh, I'm sorry, I forgot. Or there's been 1 or 2 incidents of people, you know, eye rolling and things of that nature. But as a rule, it's a mandate. It's a state mandate. It's not a Mike Covino mandate, right? So, so it's I think it's pretty easy when it comes to that, as long as we maintain a level of patience, and we just make a charitable assumption that they forgot it in their pocket or their car. And usually we don't have any problem with it. We have had it. So.
Yeah, I would say we haven't. It's a different sort of scenario for us. We don't really have a lot of people coming in. We're not a retail organization, so it has not been an issue. But certainly we have the postings up, and it's mandatory. So if someone, it would be, I think our employees have been very reliable about that. It might be someone else coming in from outside, a visitor or something, but that has not been an issue with us so far.
Good. So next question was about PPE and safety shields. And this, when you think about our audience, we got people from small, medium, and large organizations. And one of the questions was, is it the employer's obligation to provide employee PPE at the workplace? And then 2, a question of like, what kind of expenses, or how did you go about deciding, who's the arbiter for new layouts and plexiglass and sanitation? Who's the arbiter for how much safety equipment you need to put into an office space, or or in Renee's case, getting her retail setting ready for public interaction?
Well, I would say it fell in the way that we've handled those decisions. As I mentioned, we have a pandemic recovery team that looks at that. It's cross-functional, includes people from the finance, IT, HR areas, and so forth. And we really balance those sorts of things. So how many people do we have in the building? Is the plexiglass important or not? What sort of signage do we need? How many hand hygiene, different alcohol sanitizers do we need? So that's the way we do that. Of course, we're a large organization and we have a lot of areas. I'd say it's really looking at what's required and then thinking about what else would be additional safety measures, what's the practicality and the cost, and then weighing those things together.
For us, the big one is masks, right? So it's our staff is in masks. So we purchased masks for our staff. A lot of the staff want to wear their own masks, and they're fine to do so. So we did, but we did purchase masks for our staff, and we have extra masks at the desk if a guest forgets a mask, right? As far as the rest, the initial thing was we surveyed our guests, right? We sent out a multi-question survey to our email list, and we had, I think, 650-ish responses. What's important to you, right? Staff in masks, staff in gloves, hand sanitizing stations, plexiglass and whatnot. So we took into consideration what the guest perception was, and then of course what government regulation says, right? So in the end, we decided just to create a socially distanced, spaced out restaurant. We weren't trying to maximize seating by building all kinds of dividers to be closer than 6 feet, because the demand isn't there yet. Consumer confidence isn't there yet for us to be gymming in tables. So the future will dictate whether we say, wow, consumers want to come back. If we need more tables, we may then have to pay for more partitions and things of that nature. We have had a cost analysis done. It was very, very expensive to do it and make it not look like we stuck a shower curtain up to do this, to make it look like it fit the vibe and ambiance of the restaurant. We added hand sanitizing stations. We added disinfecting stations. We've spent a fortune on chemicals, and not chemicals is the wrong word, but disinfectants and things to find what's best, what's going to work best, what's going to be efficient, what's going to look good in the consumer's eyes in terms of center pull, sanitizing wipes every so many feet. So it has been similar to what I described earlier. We're spending a lot of time and energy on those types of decisions more than we are on what's the taco feature next week, or what's the next burger we're going to run at the Fix. But it is expensive.
Michael, do you have a stylish mask? I mean, do you at least have some branding going on with your masking, or?
We've looked into it. They were also expensive, but I have some very stylish masks myself.
I would hope so.
But no, we have looked into some masks or black masks that had logos, restaurant logos on them. So we don't have them yet. Okay. I'll get you one when I do.
Good stuff. Renee, I can see the beautiful cupcake right there on the in the graphics on the mask. It's just a way to get creative, right?
I know. Well, I've spent a lot of money lately, so I have to wait on the branded masks.
I hear you. So next sort of topic is safety and tracking and testing. And this is, I don't know who to ask this question. I saw a press release from UMass who mentioned, I think there were 6 sites regionally for testing. What is available for testing? And as an employer, can we require an employee who we think might have, some symptoms to get a test? So that's partly a question for what's out there, and partly a question for Joe in terms of what is allowed.
Well, yeah. So generally, the ADA is what would be implicated here, and the question becomes: is it permissible to take temperatures and or an EEOC to allow people to require people to establish that they're okay to return to work? And thankfully, the answer is yes. If given the nature of COVID-19 and how easily it can be transmitted, the law does allow exemptions for these type of things, and employers can do that. Now the question becomes, if an employee doesn't feel well, you tell him or her to go home, and then the issue becomes, well, will they do it or not? And if they don't do it, what action would you take? Those are maybe questions beyond our scope today, but employers can make sure that the workplaces are safe and that they can in fact do testing or make people establish that they're okay to work. Getting into the weeds a bit, if you do any of that at the door, right, like the temperature testing, well, that's time that those people should be paid for. So again, we get back to that pay issue, but yes, you can confirm that they're okay to work.
And Dr. Bromley, do you know whether there is testing available in Central Mass?
I don't know the specifics, but it's certainly available. If you call your PCP, they can direct you. I know that the CVS, for example, has some testing capabilities at certain sites. There's sort of the tents that are set up for testing. It's certainly available. Probably it would be better if it were more available, but there's some opportunities, and we've had to look at that. For example, some of our employees see our patients or their patients in nursing homes or assisted living facilities who require someone to test negative to go in. So we're in the process of looking at how all those people can get tested before they are allowed to go back into nursing homes to see patients.
We have a list. There's a number of testing sites throughout Massachusetts, and some are rapid testing results because we're not requiring people to be tested. But if we have an employee who tells us that a relative had symptoms, and we once they disclose that to us, we don't want them to come to work for 14 days.
Right.
Or they can go get a test, and if it's a negative test and no symptoms, they can return to work. So there's joking, it's all the legal stuff, but we have a procedure in place to protect our employees and our guests. And so if we send someone home because they come to work and say, have a temperature over, it was 100.3, now it's 100. If it's over 100 and they say, yeah, I don't feel well, and we send them home, we request strongly that they get a test. Mm-hmm. If they don't get a test, they can't return to work unless they've had no symptoms, no fever for 72 hours without any NSAID. So we have, and we're relying on the honor system. I mean, the world is, we need them to tell us the truth, right? I mean, people could come to work at Fallon, at your law office, they could come to work and have symptoms and not tell anybody, right? So we're by doing the checks at the door and by talking to our employees and asking them questions, we're sort of feeding that this is what we want to be done. We want you to do this the right way, right? If we just say, they'll tell us if they don't feel well. If we don't set those procedures up, we don't feel like we're reinforcing what we want to have happen. So we strongly request people to get a test if they don't feel well.
We do too. We kind of treated it as like, if even before this, like if you came to work and you didn't feel well and you had to go home, depending on how sick you were, I didn't want you to come back the next day. Like we're working, with people's food and we're working around other people very closely. So, if you miss a few days, you have to have a doctor's note. It's the same thing here. If you feel like you have symptoms or you've been around other people that, feel that they have symptoms, I wouldn't let anyone come back to work for 2 weeks unless there was a test. But a lot of the tests were, they had to wait 5 days anyways. And since business has been so weird, we've only worked Wednesday through Saturday, their normal work schedule, the 5 days would end up being 2 weeks anyways. So we've tried to treat it the same way, the same policies that we had before this.
Got it. So another question related to kind of testing, and there are confidentiality issues related to if you discover someone has that. So testing, if you have an HR department, are they the ones that have to sort of keep that confidential with management? And if you don't have an HR department, how do you handle that? And then the second part of the question is, does a company, what is the company's role in any contact tracing, or does that just get handed over to the state once someone actually has tested for COVID.
So let me, Joe here, I'll step in real quickly on,
Yeah.
on a couple of those points. So with regard to the confidentiality, many of us have heard of the law called Hipaa, right? There are Hipaa medical protections that attach to a positive test. So when somebody does test positively, what normally happens, of course, one disinfects the office, one does some internal contact tracing. So, right, and I forget the analogy, but what is it like? It's 6, 15, and 48, right? Who have you been in contact with inside the office that you've been closer than 6 feet for a period of not fewer than 15 minutes within the prior 48 hours? And those would be the people who we then would reach out to, kind of one nucleus out from the center, right? Those coworkers or clients or customers who may have come in that you know of, that you would reach out and talk to them too. You would then ask, to Michael's point, have those people stay away for 14 days in quarantine while they're there. As it relates to outside of the organization, that again is beyond the employer's scope. Then the last thing one would do is they would notify the employees. We've had a positive test within the organization. The people who are notified that they were within that 6, 15, and 48-hour window, they might be able to deduce with whom it is that they were interacting, right, by the dialogue with the HR department. But the rest of the staff in an organization, especially those that are a little bit larger, wouldn't have any idea who that person is, and the employer should not give up that information.
Got it.
Thank you.
And in terms of, and in terms of the contact tracing, again, the local boards of health have that primary responsibility and the tools to do outside of the employer. So certainly you would expect people to come into contact with other people outside of their workspace. So the role, in addition to notifying your own employees, is to facilitate that. So if the Board of Health were looking for contact information or couldn't get in touch with someone, you might be able to facilitate that. Additionally, it's good to keep a log of all the employees as they come in and who the visitors are, so that would facilitate that contact tracing as well.
So we're at, it's terrific. We're at 12:50, and I'm going to sneak in one last question and then kind of go to closing remarks. I want to remind everyone who's attending that this session is being recorded. You'll be able to find, we'll share a link to this entire session, as well as a link to Joe's slides, which he referred to, that had a lot of detail that we didn't jump into, and some of the other links. I think Dr. Bromley mentioned some state resources, and we will put a link there to some of those resources. So this is another resource question. One of you talked about a little questionnaire that said, when employees come in, we ask them the following basic questions. Is that also in the state resource area, that sort of very basic questionnaire you have for employees each day?
It's you can find it there, as well as the CDC, has the questions. There are also commercially available tools that you can use through a mobile device, for example, or put it on a website, or some people just use paper forms and have someone fill it out each time you come in. But they're basic questions about symptoms that everyone's probably familiar with most of them. Got it.
Well, this has been a really informative session, and we're in the middle of this thing, right? We haven't got a lot of solutions. We're all pivoting and innovating. And, the good news is, I think for our state, you look at what's happening nationally, especially in the South and the West, and, it just makes you thankful. Michael, you see a lot of, and Renee, you see a lot of retail businesses actually closing down in states after being open. And so, we're at least appear to be in better shape than others, which is not good for the country, but hopefully we'll have a smoother road here as we get back and enter the fall. I want to thank everyone for their participation. It's been a great conversation. Special thanks also to our two presenting sponsors, Webster 5 and Fallon Health, for their contributions in making this webcast and others in our series happen. So thank you all, and appreciate your being on the panel, and appreciate all the attendees for sticking with us for this hour. And look for an email with a lot of other resources that you can link to, as well as a live broadcast of this session. So thanks again, everyone.